We have all done it, lifting something too heavy. You're fine at first, but later in the day, boy, does it start to hurt. A Triad woman says she severely injured her shoulder when she tried to move this giant box delivered to her home. She took an unusual approach to treatment, using a doctor who specializes in sports medicine. WFMY News 2's Tracy McCain talked with her and the Cone Health doctor treating her injury for To Your Well-Being.
28-year-old Karey Loftis couldn't wait to get this package inside.
I was excited because I was sleeping on an air mattress at my parents' house for 6 months. So I was like, I'm ready for this bed. And I was like, I'm going to do it.
This big blue bed in a box is 87 pounds.
I was pulling in a queen-size mattress by myself, one of the ones that are in the boxes. And I was trying to prove a point to my boyfriend. He's like, no, you need to wait. And I decided not to.
Karey struggles to pull the box more than half her size, all caught on Ring video.
Again, I'm just like, oh, I got this. Like, I don't need a man. I got this.
At first, everything seemed all right, but 2 days later,
I was laying in bed and it was just like instant pain.
Karey was referred to a primary care sports medicine practice inside the Cone Health Med Center in Mebane. She was unsure, thinking the Mebane Medical Clinic was only a place for athletes.
Like with sports medicine, I think about high school, honestly, like the personal trainers in high school taping up ankles for the football team, things like that.
It's a common misconception that Dr. Jason Matthews hears from patients all the time.
I get a lot of patients who qualify for sports medicine, but they're not necessarily athletes, or sometimes it gets linked to being young. But this is something that we treat for all ages.
What's like the weirdest thing that you've ever seen?
There's probably a long list of weird things. At home, anything can happen. We're talking about some spring cleaning, a little slip on the stairs. You name it. I think it's that sudden, force and load on a shoulder that really kind of, wasn't ready for it. But to be honest, anybody's shoulder may experience the same kind of things.
Dr. Matthews says injuries from exercise or common chores can be just as serious as a sports injury. He has the tools in his office to treat them both.
We've got tools like the ultrasound to where we can kind of aid in that clinical evaluation, so we can actually take a look at structures in real time, show the patient. It really helps things out.
He used the ultrasound to find the source of Karey's pain.
What we're looking at is a essentially front to back view of the shoulder, and we're looking from out near the surface, going deeper and deeper. That's where this patient had some symptoms, and one of the areas that we targeted for the injection.
Cortisone injections ease the pain.
The labrum, the rotator cuff, and the bicep tendon were all inflamed.
And for someone who doesn't like needles,
I ain't looking at the nail. I think it was like this long.
Karey said the procedure is painless. Much easier, she says, than following the 10-pound limit on lifting, especially with a 2-year-old at home.
And she's just like, hold me. I'm like, you hurt. Hold me. Okay, I'm holding you.
She has 4 to 6 weeks of physical therapy.
Holding my arm down and doing like circular motions, trying to get it loosened.
And under their plan, Karey should be back to her normal routine within weeks.
I want to get back to where I can physically play with my daughter without an hour going by and I'm like, okay, look, mommy's got to go ice her shoulder. Mommy's got to go do this. And I really don't want to have surgery.
No surgery required, but a good reminder that thinking outside of the box could bring the best results.
Don't let the name fool you. Don't worry about coming in. And when in doubt, come on in.
Wow, all from moving a mattress. Seeing a primary care sports medicine doctor also helps your wallet too. Each visit you'll pay a primary copay as opposed to a specialist copay, which could save you around $100. We are now lucky enough to be joined by the doctor who is there to help Karey out, Dr. Jason Matthews. He's helping us explain how doctors like him can help you too. But first, we've got some sports myths to debunk here. The first one, some people say sports medicine is only for athletes. Why is that not true, doctor?
Well, sports medicine, first off, is, like you said, it's not just for athletes. You have any age, whether you're young or you're old, any activity level, whether that's sedentary and you get some carpal tunnel, you have some arthritis type issues, and of course, those higher level activities with the, more performance athletes. But we're trained, especially and specialized, to take care of anybody who comes into the door.
A lot of people wonder, should they only go to you if they have an injury, or can you do preventative stuff too?
Oh, great question. And I'm glad that this is being aired because this is very important type of things. We'll of course see you gladly during an injury and we'll treat you. A lot of that treatment, even for injuries, is about possibly preventing future injuries. But if you've got the foresight or you get a referral from your primary care doctor, we'd love to see you before injuries or before even starting activities, because we can really stack the deck in your favor so that we try to assess how your body's moving, what kind of risk factors we have, and come together, with a good game plan that we can keep you injury-free, happy, and meeting all of your kind of goals that you want from an athletic standpoint or activity standpoint.
Karey said that the pain in her shoulder didn't really start for 2 days. Is that common to see pain later onset?
Absolutely. And that's a good part too. I think it's totally reasonable to, if you get a little injury at home or at work or out on the field, to see how you do. There's conservative treatment options like resting it, icing it, and so forth that most people are aware of. But if something doesn't seem right, if you get a few days and things just aren't going away, they're getting worse, or they're just not getting better, that's a good opportunity to at least check in with a specialized sports medicine doctor like myself, or any of the number of the ones that we have here in the Cone Health system, so we can kind of get you situated, make sure everything's okay.
All right, when we get back, we'll talk more about how sports medicine might be the right choice for you. We'll be right back. We're back with another To Your Wellbeing segment with Dr. Jason Matthews. He's a sports medicine provider for Cone Health at the Mebane Medical Clinic. He's talking about his day-to-day life and what it looks like. And I'm curious, what is the most common kind of movement injury you see?
Great question. To be honest with you, there is not too many common ones. It's all kind of based on the patient. I'll see a lot of things where it's simply a knee acting up from, walking around too much.
Feel that.
Even the shoulder from pulling on something. And so we see and treat everything, but anything that's bothering the patient, it's very important to us.
In our house, instead of a swear jar, we have a jar where anytime we say, ugh, when we get up or sit down, we put money in it. How do you know when it's just like a common aging pain or one that needs to get checked out?
Yeah, great question. Typically, if something is pretty severe to where it doesn't feel like a pain you've had before, or maybe it is that kind of, swear jar pain that you're just feeling for a lot longer than you normally do. Anything that is kind of a change from your baseline, or a pain that just, you'd rather not have, those are all great opportunities to come check in with us.
What steps can people take to prevent injuries?
Great question. So, movement is medicine. So a lot of times we in sports medicine are trained to assess things like biomechanics, basically how the body's moving. Make sure that, it's moving in a good way, that muscles are balanced front to back, joints are as loose and as limber or as stable as they need to be. And if that seems overwhelming, that's okay. That's normal. We take care of that. We don't want our patients to worry about that. We just want to make sure that they're safe and healthy, and we can outline a good game plan to do that.
What type of moving should people be doing? Is walking enough, or do we need to actually be going to the gym?
Oh, great question. To be honest with you, we will take, and the data supports this, any amount of movement and activity. We've got guidelines that we recommend, but it's not really something where it's all or none. Even if, you can only get out a few times a week, that is an excellent change. And have that sports medicine as part of primary care, we're all happy about that, because that means that you're benefiting not only the joints, the muscles, but your heart, your lungs. Your body's going to be happy to get it moving.
I think a lot of people might be shocked to hear that sports medicine is part of a primary care. Why is it included in that group?
Well, I'm sure most of your viewers have been to their primary care doctor to check out their joint and so forth. Sometimes, seeing somebody from a surgical realm might raise the concern that surgery is something that they may only offer. But most, sports medicine, especially primary care sports medicine, it is a natural evolution of what we do day to day in primary care. We just have some extra, training in that light, so we can kind of help out that primary care and really offer the latest and greatest of what technology and research has to offer directly to our patients right here at home in your backyard of the Cone.
The whole goal is to keep you safe while you're out there moving about. So as we're entering another hot week in the Triad, what can people do to stay safe in the heat?
Yeah, and it has been a hot one. The great ways to keep safe in the heat are, I would say, number one, hydrate. So you want to be in tune with your body. Everyone's guidelines are going to be a little bit different, but just to make things easy, hopefully this is not TMI, but you want to check and see how your urine is. You don't want it to be too dark or too light. That's a really good real-time assessment of how much, hydration is going on. On top of that, I would say just as important, if not more so, is sun protection. Out here in North Carolina, we get a lot of sun, and ideally you want to use some type of sunscreen that provides protection SPF 15 or more. And, quick mistakes that a lot of folks can make is not applying either enough or early enough. So you want to get that sunscreen to any sun-exposed areas, including maybe some bald spots around the ears, any sun-exposed skin about 30 minutes before activity. If you're going to be doing a lot of activity that involves sweating or the water, you want to reapply about an hour, into that activity.
We can all be better at sunscreen for sure. Thank you so much for all of your advice. If you missed any of this, we're going to put it all up on our website. You can find it posted on WFMYnews2.com in just a few minutes.